When I was a kid, I grew up on the Space Coast of Florida. And you may have seen the recent celebrations of the 50th anniversary of putting a man on the moon. But when I grew up on the Space Coast of Florida, we had a tradition where schools, when there was a launch, would ring the bell and us kids would go out on these hot Florida sunny days and we would watch the space launches. As it got down closer to the time that it was about to take off, the rockets were about to take off, you could feel the ground rumble. And then you could see off in the distance, in the horizon, the rocket ships going up. In the evening, we'd go home and we would look at, on television, the astronauts in space, the same astronauts that we had seen go up earlier that day. Well, that got me thinking about, how did we get there? That was a really triumphant point in our American history. Well, the way we got there was when John F. Kennedy in 1961 gave a speech and he said, by the end of the decade, we're going to send a man to the moon and bring him home safely. And he opened up a new era for our country. Now, the interesting thing about that is that at that time, there wasn't really a Kennedy Space Center. NASA was only about 3 years old. We didn't have any infrastructure. We didn't really know how to do it, but he put a vision out for where he wanted America to go. And in a way, we're in a similar position at APA. Because a couple of years ago, our Council of Representatives directed that we should have a new strategic vision for our organization. And in the good part of a year, we spent surveying, interviewing, doing focus groups, and really co-creating a new vision for our association. And similar to where we were when our country had a vision but didn't quite know how to get there, but we knew we were going to have to work differently, we know we're going to have to work differently as APA to get and achieve our grand challenge. So that strategic plan that our council passed had several elements. The first is that we believe that we must utilize psychology to make a difference on major societal issues that we're facing as a country. That we need to elevate the public's understanding of regard for and use of psychology. That we need to prepare the discipline and profession of psychology for the future. And we have to strengthen and want to strengthen and maintain our status as an authoritative voice for our field. But like our country, we're going to have to work differently to do that. So what I wanted to do tonight is tell you a few of the things that we're doing at APA to work differently so that we can accomplish our grand challenge. Everybody with me? Okay, you got to tell me, you got to stay with me. Okay, all right. There we go. All right. So number one, we have to work faster. And I'll give you an example of how we're trying to work faster at APA, because we believe that we have something to say that's important as a field on many of the issues that we're facing as a country. The horrific shootings that we just experienced over the past week is a good example of that. So where in the past we may have taken days and sometimes maybe a week to put a statement out, we now do that in an hour, in literally hours. Getting the psychological research out on gun violence, on trauma, and what people can do to come through these horrific events. And it's making a difference, because within hours of us putting our statement out, this is the kind of press that talked about the psychological research that we were citing. And in fact, as of yesterday, we were cited in over 1,000 articles reaching over 1 billion people around the world with psychological knowledge. So working faster helps us to have the impact that we wanted to have on these major social issues. So we're not only working faster, we're working with new partners. APA has had a really long history of working well with lots of different groups. But we recognize that we're going to have to work with a broader set of groups if we're going to elevate the public's understanding of what psychology is. And so let me give you just a few examples of that. National Association of Manufacturers, probably not a group that you think about when you think about APA. But it turns out that this organization, whose members are corporations like Exxon, Mobil, and Goodyear and Caterpillar, they have a lot of needs that we as psychologists can address. So we're talking to them about everything from the opioid crisis to how organizational psychologists can help them improve their performance. And in fact, one of the things that we're really excited about is our discussions around our psychologically healthy workplace program and how the research shows that organizations that embrace that are actually doing better in terms of their performance. We're working with Farm Aid because farmers in our country have mental health challenges like the rest of the population, but often live in rural parts of the country where they don't have the infrastructure. So we're working with them to see how psychology can help them, and we can help them better address the mental health needs of farmers. We're working with the National PTA Association, helping parents and teachers better meet the mental health needs of children. We're even working with the Surgeon General of the United States on a variety of issues, from the opioid crisis to immigration to a number of issues. In all of these instances, we have the opportunity to talk about the whole breadth of our field. One of the things that I appreciate about the Surgeon General's meeting is that he was interested in the issue of stigma. And we had an opportunity to talk about the psychological research on how you reduce stigma. And so we're really trying to show how we can, as a field, meet the needs of many of our counterparts. So we're working faster, we're working with new partners, and we're also trying to work more proactively. So let me give you an example. APA has almost been the singular voice trying to ensure that health services psychologists are reimbursed at a fair rate. And we do that because we believe in the services that we provide as health services psychologists, those of you who are health services psychologists. But that work has been primarily reactive. A couple of years ago, there were proposed rate cuts that would have really devastated the ability for psychologists to participate in the Medicare program. And we were not only successful in preventing those cuts, but we actually got a rate increase on testing services. That's a good thing. Because many seniors depend on those services to get high quality services. So we're working faster, we're working with new partners, we're working more proactively, and we're working to reframe issues so that people understand the full breadth of our field. So let me give you a couple of examples, or I'll give you one example. Artificial intelligence will have a huge impact on our lives. But most people don't think of psychology when they hear artificial intelligence. They think about computer scientists, they think about engineers, but they don't think of us. But it turns out that we have a lot to contribute to this very important issue. They're cognitive psychologists who develop the models on which many of the intelligent systems are designed. They're human factors psychologists who work to ensure that the interfaces between those intelligent systems and people are designed in such a way that they work well for people. They're social psychologists who are studying issues like bias and how to make sure that big data sets don't have bias in them. And they're clinicians who are working to use this technology to better deliver services to people. So in all those ways, and many more, psychology has a lot to contribute. We recently had a meeting with a group of high-level executives from Amazon and Microsoft and other high-tech, Google and high-tech corporations, who are looking at the issue of artificial intelligence in terms of policy in our country. And we had an opportunity to talk about how social psychology could help address some of their concerns around bias in big data. That's the kind of work that really is helping the public to understand the contribution that we can make on a whole host of issues, and on this issue in particular. So, we're working faster. We're working with new partners. We're working more proactively. We're working to reframe issues. But we need all of us to be a part of this effort to take on this grand challenge to change how our association has impact in the world. And so we're going to need all of us. And I think it's making a difference. For 2 years in a row, we have had an increase in our membership. That is after years of declining membership. And so I think at our core, psychologists want to have impact in the world. And that's what we want to do. So I'll leave you with this. When I was that kid in Florida, I had no idea that I was sitting on the front row of history and observing history. And in a real way, I think that we all are, as a field, sitting on the front door or the front row of the history for a new history and a new era for our field. And I can't wait to see the heights that we're going to go as a field. So I hope you have a great convention. I hope you have a great career. And thank you for being here tonight.